Welcome everyone. I'm Councillor Matthew Winnington, Cabinet Member for Community Wellbeing, Health and Care. Just some housekeeping first. If the continuous fire alarm sounds, please evacuate this room and the public gallery by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. Members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly that they do not wish to be recorded. Please can everyone use the microphones and remember to switch them off when they have finished. I would like to welcome two councillors on new to the portfolio, Councillor Matthew Cordy, Opposition spokesperson for the Portsmouth Independence Party, and Councillor Spencer Gardner, who unfortunately cannot be here today from the Conservative Party, as his wife has had a baby boy this morning. So many congratulations to the Gardner family. We just do introductions starting to my left.
Anna Martin, Democratic Services.
Helen Atkinson, Director of Public Health.
Hannah Byrne, Public Health Principal.
Andy Biddle, Director of Adult Social Care.
Louisa Sullivan, the Group Accountant for Public Health and Adult Social Care.
Councillor Graham Heaney, Labour Group Spokesman for Community Wellbeing, Health and Care.
Good afternoon, Matthew Cordy, Councillor for Hilsey Ward.
Good afternoon, Steph Richards, representing Endometriosis South Coast.
And we also have the press here as well. Lovely to have you here, Toby. We have two deputation requests, but it will just be Steph, I think, doing the deputation. So if it's okay, Steph will just do that before the item on the agenda. So apologies for absence, as has been mentioned, Councillor Spencer Gardner and also Emma Baxter, who is the Finance Manager for Adult Social Care and Public Health. Members, any declarations of interest? No. Okay, so as the next item is item 3, Women's Health Hubs in Portsmouth, I will then pass over to Steph to do your deputation.
Thank you very much. Good afternoon, everyone. I'm Steph Richards, representing Endometriosis South Coast, and I would like to bring to your attention some concerns we have regarding the proposals. Firstly, primary care services are structured to treat individual symptoms in isolation rather than in combination. This approach can lead to inequality in care and an additional burdens on patients depending on the caregiver's understanding of women's health issues. Many women's health conditions, including endometriosis, have been shown in the new National Confidential Inquiry Patient Outcome and Death Report to require multidisciplinary care to ensure all patients' needs are met. This will not happen with a GP approach to women's health hubs. This issue results in increased costs for the NHS due to the need for various specialists and repeated appointments because of delayed intervention. For example, women with endometriosis often cycle through primary care for years before seeing a specialist. Consequently, as they stand, women's health hubs in primary care settings will not reach their full potential. Secondly, it's essential to expand the focus beyond long-acting reversible contraception, also known as LARC, in women's health hubs. While increasing access to contraception is a goal of these hubs, contraception is not a one-size-fits-all solution. LARC does not work for the majority of people with endometriosis or menopause, and including it prominently in the document will only push more GPs to treat conditions with this medication. I want to refer you to Hannah's report, section 5, page 7, which states continuous workforce development and network meetings. This is complemented by group consultations, including education, engagement events and shared clinical appointments, and proven targeted outreach to women, directly or indirectly through working with key partners in venues already trusted and used by different communities, to improve equitable access to appropriate information, support and clinical care, and tackle inequalities. We at Endometriosis South Coast would like to know when these are taking place, as the only ones that we have been invited to are those that we have actually initiated ourselves. Who is in these networks, and are the organisations actively working in the community? From our perspective, none of the proposed strategies serve the communities they are intended to help. Finally, ESC, Endometriosis South Coast, believes that our city can do better and that we are missing an opportunity to make significant improvements in women's health. Health hubs should deal with a variety of issues, such as reproductive health services that include contraception, counselling and access to various contraceptive methods, fertility assessments and support and preconception advice for women planning pregnancies. Maternal health services that encompass antenatal care during pregnancy, postnatal care and support for new mothers, baby loss, which is sadly missing in this city, and breastfeeding advice and assistance. Gynecological services that would include routine services, diagnosis and treatment of gynecological conditions such as menstrual disorders, pelvic pain, together with menopause management. They should include mental health and emotional support, which would include counselling and therapy for mental health concerns, together with the support groups of women experiencing anxiety, depression, or other emotional challenges. Sexual health services that involve testing and treatment for sexually transmitted infections and education on safe sex spaces. And finally, health promotion and education that encompasses workshops, seminars and educational materials on women's health topics, promoting healthy lifestyle choices through nutrition, exercise and stress management. The proposals for our city just cover a portion of what is actually required, and we urge all stakeholders to reconsider and include all these elements that I've mentioned. Due to the design of primary care services, individual symptoms are treated in isolation, leading to increased inequality in care and patient burden. This also results in higher costs for the NHS due to the need for various specialists and repeated appointments, thus making each GP surgery a women's health hub will not be effective. Thank you so much, Matthew.
Thank you very much, Steph. So I'll now hand over to Hannah and Helen for Women's Health Hubs in Portsmouth, item 3.
Thank you. The paper that we submitted was in relation to the work that was being done locally under the Women's Health Strategy, which has brought some NHS funding down to us locally. Being in public health, we're under the local authority, so we're unable to respond on behalf of the NHS, but we are able to talk about what our partners are doing in partnership with us. So we recognise that the data does indicate that women live longer than males and that more of their life is spent with poor health. We understand that health and care is complex for individuals and strategically. We hope that we understand for the health and care of women, girls and other assigned female at birth, this is made more complex through split commissioning and services located in different sites. This isn't just clinical services, but those other support services that are spread across the city. And this is found across every area. But there's work being taken to support our general practice to provide more holistic care within appointments rather than providing multiple appointments. We're working with practices who want to be able to provide better care within single appointments for longer portions of time. Although the Women's Health Strategy for England was published in 2022, we've been working on improving women's health care in Portsmouth since 2019, a lot more in partnership with across the city. We've been aspiring to make it easier for residents and for system partners to deliver a sustainable approach to optimise on resources, improve outcomes and tackle gender equalities and other equalities across the subsections of the population. We recognise the Government Manifesto states that never again will women's health be neglected. We hope that our approach will contribute to this ambition through women's health hubs, but also with wider system approach to strengthen healthy conversations, access to accurate information, and appropriate high-quality services. We really want to ensure that we're not just focusing on the women's health hubs, but we're really optimising on those key assets, those community assets, working with venues such as our family hubs and other venues where we're working with, where women and other people feel safe to be able to talk to key champions. We want to be able to train up more people to be able to have those healthy conversations, be able to initiate those conversations through to helping people identify their needs and where the best places are to go. We recognise that general practice is able to provide the core services under the Women's Health Hub core specification, which is where we're starting with the funding that we've been able to get through the NHS. So it is the responsibility of the GPs' practices to understand their own population, while we can support them with the general population information. We are also supporting our GPs when they are recognising that there's areas of work that they can be doing by helping them to link in with other organisations. We also have got outreach in a number of settings, whilst we also have this opportunities to actually base some of our healthcare within some of the community assets which you mentioned. It's a constantly evolving piece of work locally, and there's multiple partners involved, and we're constantly building and seeing more relationships being built. We want to constantly build the evidence, build evaluation through what we're doing, and sharing good practice. So our proposal is that the local approach to deliver sustainable women's health hubs in Portsmouth is taken to the Portsmouth Health Overview and Scrutiny Panel by partners involved.
Thank you very much, Hannah. Helen, did you have anything to add?
Thank you, Councillor Willington. I would just, to build on Hannah's opening, obviously this came on the back of a full council motion about supporting women to remain economically vibrant in the city. In a way, this paper came out of a broader, I think, request from full council, and we tried to broaden the ask to show how we're trying to improve, which is a public health outcome. It's part of our role, statutory role, to improve outcomes for women and girls in the city and improve health outcomes. I think to put it in a context, which Hannah has been working very closely, the women's health hubs are actually an NHS programme, and is very much top-down, coming down, and there is some NHS funding, but it isn't to deliver services. It's actually to support how we can perhaps bring some of those services together, the communication. So I think what Hannah has been working within the team and working, because we are part of Health and Care Portsmouth, so we have an integrated approach to how we work together. It was to ensure that the focus through the NHS was broadened to include the work that we have the statutory requirements to lead on, which are sexual health, to ensure, even though it's an NHS programme, that we try to align and broaden the approach to ensure that we weren't siloed, because services for women, I think traditionally why this has been a national programme, have been very, very siloed and separate. So taking all of the points on, it is the start of trying to ensure that we can actually come together. So providing a service for women and girls, which is more integrated as an approach. And that's really the aim. It's very new. The programme was only just starting, and in a way that's the aim that we're trying to focus on, is to actually ensure that services are not siloed and that women don't have to go to different places to actually get their services, but taking on point all of the comments that Steph's raised. So that's really it.
Thank you very much, Helen. Colleagues, any questions or comments? Graham?
Yeah, I think I reread this report because obviously I saw it at the briefing last week and I asked a couple of questions, and I think in some ways there's a bit of a mismatch between what people expect from a notion of a women's health hub and what is actually being delivered. I think there was a bit of a mismatch there. Because when you read this initially, you think there are going to be health hubs in all areas, but of course as you read the report more clearly in detail, it's not about funding specific services, but trying to fund support for better connected working. And I think I said at the briefing that one of the problems I suppose that people face, women face as well, is that whilst the emphasis in the report says that these are being provided through GP services, so there are women health hub type provision, maybe the experience of people who use it is not as good in all practices, and that's the problem we have, is that there's a maybe depending where you live, depending on what practicing, you may not get quite as good a service as if you're living in another area with a different practice. And I suppose the question is, how do you make that better? I suppose one of the things that we can do is obviously make sure there's more joining up with the NHS, because it's one of these awkward things, isn't it, that public health and NHS really do have to work together, because there are so many issues that cross them over, and it's quite difficult when we're funded differently and our sort of lines of authority are different. So I'm wondering if maybe this is something that could be taken up by the Health and Scrutiny panel later on, is to monitor what the NHS are doing, keep an eye on them and ask them to report back directly on that, as well as picking up what the local authority does. And we've got a meeting coming up on Thursday. I had a quick look at the agenda. I haven't read all the papers yet, but if there's anything on there also I'll pick it up. But if not, I'll certainly be happy as Vice Chair of the committee to raise that and ask that we actually come back with more information from the NHS about what they're doing on that to make that more effective. So I suppose, yes, I think there are still concerns about, are women getting the sort of service, and are all GPs joining up? Because quite literally when you go as an individual patient with your particular concerns, and GPs will often treat you like that, and they may not make connections with other cases they've had. So I suppose that is the dilemma. I suppose the other thing I think I mentioned and was that when we do survey work on women's health issues, is picking up some of the information from that to see if we can find ways in which women are either getting a good service or not getting a good service, because obviously there's a good practice going on. We want to try and identify that and get that replicated. So when we're doing surveys about health and women's health in particular, we should try and do more on that, I suppose. So I obviously listen to what Steph said and recognise the difficulties there, but I think at the moment we're in a bit of a dilemma because we can't direct the NHS to do what maybe needs to be done. We've got to find ways of trying to encourage better practice and push that on. So it's a bit of a long-winded response, but I hope that's helpful.
Thanks, Graham. Matthew, did you have any comments, questions? Can I just start by saying thanks to Steph for coming to give your deputation today. I think I can understand your frustration in terms of how this is set out, but as has been mentioned, this is a scheme that has been sort of passed down from on high by government in terms of how we can do that, and it's come through the NHS. I think we do have an advantage in Portsmouth because we do have much more integration than most places when it comes to the local authority and the NHS working together. But as I think Graham mentioned, when you have in there the fact that most of our GP surgeries are having the aspects that is required of them as health hubs, but not all of them. But there's nothing we can physically do to make all of them do it. Though we can work on best practice to move that forwards. And Hannah made a very salient point that I noticed she specifically spoke about antenatal and postnatal support, which of course is being delivered through our family hubs, through the Family Hub programme. So, so though we don't have a physical single hub, there are aspects of that which are actually right across our city. So rather than having one in one place, you actually have them more out in the communities doing that. And of course, as mentioned in the background under the Women's Health Strategy, which says that national objective to establish and develop at least one women's health hub in every integrated commissioning board or integrated care board by December 2024. And of course, that's Hampshire and Isle of Wight. So us having multiple places in Portsmouth where we can deliver that, I think is or as much as we can, and encouraging that working together, I think is really salient. But as has been mentioned, this is something that we will carry on working on to make sure that no people are left out, including, of course, people with endometriosis, and having known many people who are involved in that locally over many years, I know that that some of the issues that your community has can be very, very difficult, and we should always be taking into account all women. Something we are doing, just as something which is very coming up, very new, will be some work we've done co-producing with women with substance misuse issues, and that's going to be coming online very soon, and we'll be talking about that once that's started, and that's a really exciting way of engaging with women about the substance misuse, but also all those the often comorbidities they have as well. And I think that's one of the things that we can do as a system, and certainly as a council, is really make sure that we're spearheading that co-production of spaces. So you coming here today and giving your deputation is a really important part of that as well, because that's giving a voice to, a public voice to, in this forum, to saying what your concerns are and also what you'd like to see. As Graham said, the recommendation here is for this to go to HOSP. Originally, that came from a conversation I had with the chair of HOSP before our briefing on this, because having discussed with Helen and Hannah about the fact that this really is funded from the NHS and the HOSP is there to hold the whole of the social care and health system in our area to account, that would seem to be the most appropriate place, because they can do that. And for those who don't know, HOSP is made up of counsellors and counsellors from Portsmouth, but also from South East Hampshire as well, so our surrounding area, which means that they can really ask those questions, not just about what's going on in Portsmouth, but also how the acute hospital is working, and also for those in the surrounding area. And some of our work that we do here, they can then take beyond to places like Gosport, Havant, Fareham, and East Hampshire. So, so I think this is, I welcome the report, I welcome the work that has been done. This also all fits in with the work we're doing on with our annual GP summit, so this can certainly be more that we can really push that within the GP summits that I host each year, that we can really push further as well in terms of other primary care, especially pharmacists, how we can make sure that they're involved with some of those issues, because helping them work together more closely with GP surgeries, and indeed the ones that are producing these women's health objectives can really work as close as possible together. And for us as a corporate body to say to the integrated care system and the integrated care board about really pushing for them to push up so we can push down. And then finally, as Hannah mentioned, the new government has put this in their manifesto, about, I think I've got the quote here, never again will women's health be neglected. Labour will prioritise women's health as we reform the NHS. We know reports, we were just talking before this meeting, reports coming in September from Lord Darzai, who's going to be looking at how that NHS reform under the new government is going to come. So I expect that's going to be the heart of that. And I would really, my plea would always be to, you put it in your manifesto, let's make sure that funding comes to make sure we can do that. And perhaps it might be an aspiration that instead of having a health hub in every integrated care board, it might be in every locality, which would be something if we could get some funding for that. But I'm sure our colleagues from across local governments and across will be pushing up with that message as well. I'm sure when we have conferences later this year, once we understand a bit more about what's in Lord Darzai's report, that we'll be able to respond to that and get the funding that women deserve in our communities. So, as per the recommendation, if I can get it up to the right place, I am happy to, so it is recommended that the Women's Health Hub's development programme of work is referred to the Portsmouth Health Overview and Scrutiny Panel for their consideration, and as Graham has said, and as I say, I've already had a talk with the chair there, they will continue the work to hold the NHS to account, work to make sure that they are doing as much as possible so that every GP surgery is providing the services that is in the Women's National Health Strategy, and also about how that allocation of resources and the support they get from elsewhere in the NHS. Okay, so item 4, survey of adult carers strategy and action plan. Andy, over to you.
Thank you, Chair. So the report in front of you, firstly to express my gratitude for Ben Muller for pulling this report together and the appendices together. Ben couldn't be with us today, but has done a lot of work on this for us. So we've got 3 pieces of information that we have in this report. The first is the proposed Portsmouth Carer Strategy for the period this year, 2024 to 2028, and then the action plan that's linked to that strategy, and then the results of the Survey of Adult Carers in England, abbreviated as SACE. That particular survey is a biannual survey that's done and returned to national government as part of the Adult Social Care Outcomes Framework. So we're asking as a recommendation for the Cabinet member to note the outcomes of the survey and endorse the carer strategy and action plan. I won't go through it in detail as you've had the report before you, but it outlines essentially our commitment to supporting unpaid carers in the city. I think all of you will be aware that there is an army of unpaid carers both locally and nationally who enable both the NHS and adult social care in this country and children's social care in this country to function. It's worth the equivalent of another NHS, so that's in the region of £160 billion a year, and there are in the nature of about 6 or 7 million people in this country providing unpaid care. So under 3.2 we've set out in brief the key objectives of the strategy that are talking about support for carers, both in terms of breaks that they might need and replacement care, trying to support carers to live the life that they choose, giving them the opportunities to expand social lives and to find and retain employment. And we particularly picked out from that the implementation of the Carers Leave Act, which came into force in April of this calendar year, which entitles informal carers to request weeks unpaid leave a year from their employer to support them with caring. Under point 3, identifying and recognising and involve carers in decision making and planning, and attached to that listen on point 4, listening to and co-producing with carers in the way that we work with carers, and then measuring and reporting progress. And what we're proposing in that particular area is asking informal carers in the city to judge how the action plan has been progressed to contribute to that and to help us ensure that we're working with carers rather than doing to. Under 3.3, we've talked about some of the outcomes from the survey of adult carers. We've seen an increase in satisfaction in Portsmouth by about 10% in terms of services that are provided. Being included in discussions, we've seen a modest rise of 2.5%, and we've seen a slight decrease in the proportion of carers reporting that they have as much social contact as they'd like, and that translates into some of those areas in the action plan that we've highlighted in the appendix. We continue to see increases in the people that find it easy to find information about services, but very conscious that much of our information in the modern age is contained digitally, and there's still a need to reach out to people that may feel digitally excluded, providing paper information, verbal information, and working through our carers centre, but also through our partners, because the strategy that we're endorsing here is a multi-agency strategy across Portsmouth. We've then highlighted the Carers Action Plan, tried to give some clear actions as to how we're going to work to implement the strategy, and also indicate those partners that are going to work with us, and that's contained in Appendix 3. And then, as I mentioned earlier, under 3.5, talking about establishing a strategy oversight group with informal carers to ensure that we're meeting what we say we'll do in that action plan. So in summary, we've laid out the carers strategy, we've laid out the action plan, and we're hoping that the carers group that we're going to establish will be a valuable part of monitoring that. There are no legal implications apart from the Carers Leave Act, which has already become law, and there are no direct financial implications arising from the recommendations in that report. That's a brief summary of the report, but as always, happy to take any questions, queries.
Thank you very much, Andy. Any comments or questions? Graham? Yeah, go ahead.
Yeah, I'm going to raise an issue around the Portsmouth survey. I must admit, when I read this first time, I didn't quite pick up, because the appendices say carers strategy, survey of adult carers in England, and carers action plan, and it refers to the survey of adult carers in England in paragraph 3.3, but what we actually have is the Portsmouth survey in Appendix 2, I think.
Yeah, we have the Portsmouth results. The full results for England will be published nationally.
Right.
And I may get this slightly wrong, Councillor, so apologies. I'm not sure that that's been published yet, but I can verify that for you. So yes, apologies, that's a slight error.
Because interestingly, the comment on 3.3 is presumably about the proportion of carers who report being included going up within the survey in England. But if you look at our results on page 44, they don't look quite so good, because, I mean, we've got numbers here rather than percentages, but 52 agree that they have clear information involved in planning, listened to before any changes and support are provided for the person they care for. 9 strongly agree. 25 disagree, 22 strongly disagree, but 58 don't appear to have a view, which I find really odd in a survey, because you would expect someone would have a view about something like that. So I'm not quite sure what that means in terms of how we've had a response there, because it does suggest we do have quite a bit of work to do to make sure people are given clear information, are involved in planning, because it does seem that not everyone appreciates that, because based on the England survey, I mean, 74% sounds okay, but it's still nearly nearly a quarter of people don't appear to have that. So, what does that survey actually tell us in those figures, do you think? Or are we going to have to guess a bit? Why do people not feel they can say positively or negatively whether they're involved or not?
It's very difficult to say, really. I think what we often see, and I'm not saying this is definitively the case, but what we often see is that people have different terms for how they interpret things. Working with carers, we offer an assessment under the Care Act, in that carers are treated in parity with those people that receive services. But sometimes our carers would say to us, no, I don't think I've had an assessment when we've been through that process. So it very much depends on people's definition of what they've received. I think we do have some work to do. I think you're absolutely right from our local figures. we've had some positive results in some areas for some time, but there's most certainly always work to do, and that includes the work to do with identifying carers, because we work with in the region of about 1,000 people in the city, but there will be several thousand who will be carers. So enabling people to identify as carers and then for us to advise them what support is available for them is a continual piece of work that we do. And I think it would be broadly the same thing for those people that have identified here as not knowing or not being sure about those terms. It's worth highlighting that this is a national survey, so the ability to put local items or local interpretation within that survey is restricted, because it's got to be returned as an All England, or rather it's got to be reported as an All England survey. So I think you're absolutely right. I think we have work to do. I think people differ in how they define the service or support or information that they've received and where they've received it from. The other thing that would be worth noting is that often information for carers won't necessarily come directly from adult social care. It'll come from the library, it'll come from the Hive, it'll come from informal carers groups, and whilst we may support them, it could come from Solent, for example, NHS Trust, it could come from the hospital, it may not be identified as coming directly from the local authority.
Matthew, any comments or questions? Okay. Thanks so much for this, Andy, and thanks in particular to the team at the Carer Centre for putting everything together and for all the work that they do. I know Ben very well, and I know the passion he has for our him and the team there have for our informal carers, unpaid carers, because actually in many ways they are very formal, because they are at the heart of that. I've said before about the fact that our entire, and it is mentioned, the entire social care system would fall apart without unpaid carers, and they are the heroes of our society. And this was something that, for one or two reasons, for COVID and other things, we were a little bit overdue. So I wanted to make sure that this came back on the agenda. I'm really pleased we've got not just a strategy, but obviously the action plan as well. And I think by having the action plan as it is, and picking up on some of that feedback we've had from the National Carer Survey and our local engagement as well, it's really important to have really clear goals that we want to have. I'd like to particularly pick out about the accelerating reform funding that we've doing, which had to be applied on a integrated care system basis, and we are working with our partners, with a charity who are leading on that with us to better engage with our carers and work that through, which is through until next December. I think that's something that came up at National Children's and Adult Services Conference year before last, I think it was. Yeah, the year before last. So back end of 2022, and we were really fortunate that we managed to get together all the four authorities in within the integrated care system, so we could move that forwards and really work on and that's really helped with our strategy work. One of the most important things is about people actually identifying as carers, because a lot of people, they just think I'm just looking after my mum or I'm looking after my daughter. They don't see themselves as carers, and sometimes they're told, no, you are a carer. You are eligible for that support. And so that's one of the big things that we're working on to make sure that people are aware. And of course, again, that's within our strategy. And I will obviously point out that for my particular party, the Lib Dems, this is a really, really key. This is a key part of our general election campaign, and it's something that we are passionate about locally and nationally. So I'm really pleased again to make sure that this is here today and we're moving forwards. And I'd finally just like to thank every single one of our informal carers. We owe you an awful lot indeed the city and the system, health and social care system, owes you everything. And do let us know as well if you don't feel like you're being supported properly. Do come to us. We're always open to do that. And as Andy's mentioned, the team that's going to be evaluating this is involving unpaid carers, and that's really important again because they're the experts on this, and they know what is needed and what they need. So, really happy to take this report and do my recommendation. So, the Cabinet Member for Community Wellbeing, Health and Care note the outcomes of the survey of adult carers and endorse the Portslade Carers Strategy and Action Plan. And I'm very happy to do so. Okay. So, final item on the agenda today is back to Andy for the Integrated Learning Disabilities Service Annual Report.
Thank you, Chair. Again, my gratitude to Ian Chowcroft, Service Manager for our Integrated Learning Disability Service, who's pulled this report together. This is an executive summary. Whilst it runs to some 10 pages, the actual report itself was some 40 or 50 pages. So we've tried to pull out the essential points for the service. So we've listed some of those challenges. Demand has continued to grow with people with increasing complexity of needs. We have seen a lot more of our younger residents transition across, i.e. To become adults and then need adult social care and health care and support. We've seen quite a lot of turnover in our staffing in the last year. That's unusual. People tend to stay within our learning disability services, but people have reached retirement, they've moved on, and so we've had some delays in recruitment, which has given us some challenges. Provided some statistics around the workforce itself from item 5 onwards and how the team service is working to support each other to work in a healthy and well-being focused way. And at the bottom of page 2 there, we've talked about, very importantly, having apprentice students coming through the team, which is really important, not only because they'll provide us with some objective analysis of how we work, but we find in Portsmouth oftentimes that those people that have placements with us then come and work for us, so it's a way of growing our own workforce. Moving through into item 6, we put the key influences there of how the service works and why the service works. It is an integrated service. It's whilst people retain their employment with either the NHS or with the local authority, they're based together and they work together and they pick up tasks from each other's workloads. So it is a truly integrated service. And then we've given some statistics there in item 7 around the activity for the service in the last year, and picked out particularly at the end of that paragraph around the hospital liaison team. It's a really important service for us all. Going through the acute hospital system can be disorientating and can be confusing. That can be particularly so for our residents with a learning disability. So enabling the wards to provide particularly focused care for those residents that go into hospital is really quite important. We've then listed some of the key performance indicators for 23-24. They're all very ambitious and we've done well. We do have, pointing out at the top of page 4, some work to do on recording the health action plans. We've been very successful in supporting primary care with health action plans for residents with learning disabilities, but we need to record them better because that's not a true reflection of the work the team's done over the year. We've covered off the national benchmarking data, so that's national across NHS trusts, and put there some of the results that we've had in Portsmouth, which show the work the team's doing. And under 7.3, the service itself is rated because it's rated through the NHS auspices under CQC, and it's been rated as outstanding, which is the highest rating that can be achieved. We've talked about housing. It's particularly important not only for people to be able to move on to more independent settings and out of residential care, but also for those people that have an ambition to leave home and live independently. And so we've included some information there about housing options and numbers and referral points for us. And we've particularly been pleased this year, or last year, sorry, as in most other years, in working with housing colleagues, so that whilst we have a limited amount of land and housing in the city, we are able to include those of our residents with a learning disability in housing needs and bring forward projects to provide adequate housing. We've given a brief overview of the budget, and then what we've done from 10 onwards is provide some of the specific services that come through that service. So hospital liaison, the intensive support team, occupational therapy, and speech and language therapy, which is working to try and ensure that our residents with a learning disability have the same access to health and care that any of our residents without a learning disability have. So trying to manage that health inequality need. Excuse me. We've then, from 11 onwards, talked about health facilitation, so work with primary care, learning from people that die early with a learning disability, and working with those of our residents with a learning disability that are diagnosed with dementia. And then from point 12 onwards, we've talked about our co-production and co-working, not only in terms of feedback, but also helping ensure that those people that come and live and work in our city, working for people with learning disabilities, there are people with learning disabilities as part of that recruitment process, that we're not just checking services ourselves, but we're involving our residents in checking the quality of services provided. We've talked about training, and we've talked about our carers group pretty much as a subset of that previous paper we've just had talking about carers in Portsmouth. And then under point 13, moving through the report, we've talked about multi-agency risk management, very important where we have complexities of risk to people and we're trying to help people feel safe and be safeguarded in the city. And we've then talked in 13.1 about the family safeguarding model and how that works in the city. Something we're particularly proud of under point 14 is supporting the development of some video resources to help employers in the city understand how they can work productively with our residents with autism and a learning disability, aiming to boost employment within the city. Excuse me. We then talked about, under point 15, collaborating with our providers. There are a number of providers, local and more regional, within the city who provide services to our residents with learning disabilities. And then we've touched on our Learning Disability Partnership Board that's been going for a long time and is particularly valued from both our residents with learning disability who sit on the board, but also providers and invited guests. And we also produce newsletters during the year to continue telling the story of our Learning Disability Partnership Board. Finally, under point 17, we've picked out a few areas of engagement in the city that help to maintain physical health for our residents with learning disability. And then we've rounded up under conclusion around our increased demand, but our additional funding that we've attracted for recruitment in the city, and how we continue to have high ambitions for our residents with learning disability. Hopefully that's a reasonable short summary of the report. As always, happy to take any questions or queries.
Thank you, Andy. Any comments or questions? Great.
Yeah, it's overall it's a positive report and welcome it, but I did want to ask two questions really. One is to go back to page 4 at the top about this issue of the health action plans. The report says it's an issue of reporting rather than anything else, but I just wonder whether if we're not reporting it properly, how do we know it's happening? In my somewhat simple sort of mind, you would have a health action plan which has a name on the top of it that goes as a document with people, and therefore it would be easy for people to access and therefore update as necessary. So where is it going wrong? That's question 1.
I'll need to get some more detail on that. My understanding is that it's about being able to report it in an automated way. And so I think what the service is saying is that they have to go through records to find them, which actually speaks to your point about it should be a part of the health passport, which I think you're referring to, so that people can take that with them. So my understanding is they are being completed, but it's the recording that is at fault, so we can't report on them in an automated way. But what I'll do is ensure that that is the case, and I'll come back to you with a more detailed response.
Thanks, Andy. The second question relates to the page 5, paragraph 9 about the budget overspend. The paragraph underneath says that the overspend is mainly due to significant increases in high-cost young people transitioning from children to adults, and talking about the team managing care costs. Now, I would assume that if you have a young person who is going to become an adult and going to transition, that you would have some indication in advance that they were going to be transferring. So I'm wondering whether this is an issue of the actual service, or whether presumably it's not accommodation costs here we're talking about, it is actually service costs. So how come we miss out on the planning of that, apparently?
We do work with quite a lot of our residents from the age of 14 onwards, when it becomes clear that they're going to need support in later life. But some of our residents will have been placed outside of the city in quite expensive accommodation. And so there's often the need for some intensive planning to see, one, if we can bring them back into the city, because we'd always prefer that in terms of maintaining kinship networks and friendship networks in the city. And also being able to monitor and understand if we can enable the care and support that they need for a better price, a more realistic price. So whilst we do work with a lot of our learning disability population from quite early on, it can often be quite intensive work. There is something that we've had in plan, but we haven't got in actuality as it stands at the moment, which is talking with our children's social care colleagues about how we try and get in earlier in terms of commissioning services, so that if we are having to place people outside of the city, we've got an adult commissioning head, if you like, on how we're doing that and working in closer collaboration, I think. But that's not come to fruition as yet. We want to do it as an ambition, and we hope that'll control costs, but also ensure people get the care that they need. So we do see a lot of our folk, a lot of our residents quite early on. Sometimes people will slip through the net and we won't get notified until later on, and that makes it more difficult to then manage those costs down. What we also see with quite a number of people is, once we are able to work with them as adults and use things such as the intensive support team or the speech and language therapy team, occupational therapy, we can lower the complexity of care needs and thereby lower the cost of the care that they're having. But that's often an effort once they turn 18, and we want to be much more upstream in our financial planning. So I think we do have quite a lot of success, but there is very much work to do in the way that you suggest.
Thank you.
Thanks, Graham. Andy, just on the, it's mentioned in there about fusion at the start of the report in terms of informing what we're doing. Obviously, the new Community Health Trust was supposed to have come into place on the 1st of July, but because of the general election, it is now being delayed. Do we have any inkling about when that might be happening now, and also whether with the new trust there might be any impact on the way that our integrated learning disability team functions?
Thank you. We don't have any prospective date as yet. Our understanding from our colleagues in Solent, which is the part of the future trust that we have a lot of dealings with, a lot of partnership work with, was that would be on the list for the new Secretary of State, because the creation of a new health provider trust is signed off formally by the Secretary of State. So we don't have any update on that particular date. There were some movements made prior to, it was supposed to be the 1st of July, was supposed to be the organisation would come into being formally. We did see services from the Isle of Wight Healthcare Trust transferred in to the new organisation prior to that, and we saw some services for children and adolescents with mental health needs transferred in prior to that. But the big bang, if I can refer to it colloquially, between Southern Health and Solent didn't happen and has been parked at the moment. We do have ongoing conversations, and we've been involved in some of those forums that have been discussing how the new trust will work, how it's going to look, those kind of things. We don't have anything formal as yet as to a structure. but we do have some assurance from our colleagues that they recognise the benefits of the work that we do together in Portsmouth. Certainly from the perspective of residents with a learning disability and residents of working age with mental health problems, we are very integrated in Portsmouth, and so that's acknowledged by the new trust. It's interesting, I have an appointment next week with the Chief Executive Designate excuse me, of the new trust, and those are the kind of issues that I'm looking forward to discussing with Ron Shields. Our local colleagues have also been advocating that we need to ensure that however the new trust is configured, we retain the benefit of the integrated working for the residents of Portsmouth. So I guess in summary, there's no written guarantees that we'll continue working in the way that we have, but what we are hearing from the designate new trust, if you like, is an understanding of how we work in Portsmouth and an understanding of the value of the services that are provided to the residents of Portsmouth. I guess the other thing, just reflecting on this report, is for a service to be rated outstanding is quite significant, and I think probably indicates the quality and the level of support that's available for our residents.
Thanks, Andy. And speaking about inspection, obviously the outstanding rating was given in 2016. So would we be right in thinking that we probably are due an inspection?
Whilst hesitating to speak for CQC, I would imagine so.
Thank you. And again, for anyone who is watching, if you get outstanding inspections results, then they leave you for quite a while before they do it, but not forever. So I think 8 years might be we might be expecting something reasonably soon. So thus, but as Andy has sort of indicated, I think we're always on our toes because we know things can't be too far off. I was just going to make a couple of comments just in terms of obviously thanks for the report, and again, our learning disability team is fantastic and has really great response. I think in particular the Learning Disability Partnership Board, which is facilitated by staff but is chaired and run by people with learning disabilities, is outstanding. And of course we still believe the country's only paid learning disability champion, who of course is one of our former Ordinary Alderman John Atchell, who is of course an ex-city councillor as well, which I think we're very, very grateful, and for all the work he does in being a tireless advocate for people with learning disabilities here. And the final thing I was just going to say, which is just on a slight tangent, was just about our higher demands, and that really does reflect what's going across adult social care, certainly last year and so far this year, in terms of demand on the service is higher and the costs are going up. So we're getting a double whammy, and again, from what we've been receiving in terms of our grant from government, is just not keeping up for it. So I really hope the new government takes a really good look at that and make sure that social care, not just in Portsmouth but right across the country, is properly funded, and within that as well, in terms of higher demand, as people are living longer with learning disabilities, the prevalence of dementia is getting higher. So I'm really pleased we've got our dementia pathway there, and we're working with our people with learning disabilities who are then being diagnosed with dementia, where it's previously in the past, because the support wouldn't have been there, the medical and social support, they would have died earlier. But it does mean that we have to make sure they're supported right through their life, and when dementia becomes more prevalent. And again, we talked about people with transition who are younger. There are people who would have died in childhood who are now becoming adults, and certain people with learning disabilities, certain conditions would have an instance of dementia much earlier in life than the wider population. So I know there's a lot of work being done, not just within the LD service, but also looking at certain NHS Trust in terms of dementia support for younger people with dementia, whether they have learning disabilities or not. So very happy to note that report, we, yes, look forward to your meeting with Ron, Andy, and also when we have a date for the new trust coming into place, I'm sure we'll share that with people, and also after that there will also be about how that structure works, and we're obviously making sure that we are speaking on behalf of Portsmouth to make sure that we have that place-based work that we do, which will include our integrated working on learning disabilities. So thank you very much, everyone.